cancer-fighting cells made directly in our bodies. Wow, it's cool, but what exactly does that mean? I'm Chloe Kirk with Biotech TV. Let's talk about it. So, light refresher. Our bodies have these T cells, our guards, targeting unwanted visitors. They target by having specific receptors that recognize and bind to an antigen on an unwanted visitor. Researchers have figured out how to make T cells with specific receptors, called chimeric antigen receptors, or CAR for short. In these CAR T cell therapies you hear about, researchers make in bulk these T cells specifically targeting an antigen on the surface of a cancer cell. It's taken off in the cancer world as a great new way to single out cancerous cells, hence a Nobel Prize this year being about T cells. But it is expensive and laborious, as you have to essentially have custom-made CAR T cells made for each patient, so it's not realistic to scale up. That's why there's been a lot of excitement about getting our bodies to make CAR T cells, and a couple clinical trials are doing exactly this. One of them just released some preliminary data at the American Society for Haematology conference this week. Haematologist Joy Ho of the Royal Prince Alfred Hospital in Sydney, Australia, presented positive first-in-human data from phase 1 InMyCAR trial of KLN-1010, an investigational in vivo CAR T therapy sponsored by Boston-based Colonia Therapeutics. 1 month after receiving a gene-carrying lentivirus, all 3 patients with previously untreatable multiple myeloma had no detectable cancer cells in their bone marrow. The cells were still absent in 1 patient tested 5 months later. This gene therapy generates anti-BCMA CAR T cells, targeting a protein expressed on the surface of multiple myeloma cells. KLN-1010 is administered to patients via direct transfusion and is designed to generate durable CAR T cells inside the body after a single dose. It's a really cool glimpse into the future, as Ho says, but of course much more evidence is needed both in terms of volume of the patients and the length of study, likely needing years of follow-up. And some researchers note that using lentiviruses for delivery poses a particular safety concern because they're integrating cargo into the DNA of host cells, a possible trigger for cancer. The phase 1 trial is continuing to add patients, while other companies are also planning to start trials, including using lipid nanoparticles instead of lentiviruses. And to note, this isn't the first trial this year showing positive findings from in vivo CAR T cells, but this is the first trial to have much less side effects, which means we've gone from if we can generate CAR T cells in the body to when we can do this in scale. I'll see you next week.